So I'm doing a live today. I want you to. Okay, so hello everyone. Okay, so this is a live section. Actually, I want to talk about something very important. So I would like you to share this video to your loved ones and friends and kindly invite them to listen to what I have to say about this very important discussion today. So today I would like us to talk about heart failure. But before we move on, do me a favor to share this video to your loved ones and friends so we can all learn together what actually heart failure is all about. And if you have any question around heart and heart failure, you can drop it in the comment section. I'll be glad to answer those questions as well. So now I just want to say this. The heart is one of the very important organ of the body. It helps pumps blood, oxygenated blood to all parts of the body. Now, all parts of the body receives oxygen, and this oxygen is found inside the blood that is being pumped out from the heart to all parts of the body. Even the heart itself receive oxygenated blood for it to function, because we need this oxygen to undergo all the metabolic processes in the body for us to live long and to do our daily activities. Now, sometimes what can actually happen is that the function of this heart may gradually decrease. So let me just give you an illustration. You see, usually when we're in school, primary school, usually we want to get our exercise book, especially when we buy a new exercise book. Okay, we want to have the first four, or let's say first page. If it's a homework book, you want to score 5/5, and the second page 5/5, the third page 5/5, the fourth page 5/5. Use an exercise book, a new exercise book. Your whole goal is to get the first page 10/10, second page 10/10, third page, and to the fourth. The reason is simple. I don't know where you schooled, but usually my school during the primary school days, um, when we are about writing our exams, they take our exercise books, our homework and classwork books, and they kind of look through it and give us scores, and that scores us up to our terminal exams, and then they calculate it all, and then it gives us whether we have to be the first in class, the second in class, or the third in class. So as you get a new exercise book, or maybe let's say that the time I just resumed and you are starting a new fresh start, you want to get 10/10 or so, because you know that at the end, these first four exercises usually want to you getting first, second, or third position. Exactly. And sometimes the exams you are striving to get 100% or 80%, because you know that's where you want to, if really want to become first in class, you need that as well. The heart also can function like that. The heart can function at 100%. That means the heart is functioning at the right capacity. Or it can function at 80%, 70%, even as low as 40%, 20%, 10%. At this point, from somewhere around 60% thereabout, we then classify the heart as failing. Usually in our school days, when you score above 80%, you have passed, but then below something like 60, 50, then you are failing actually. So that's what the heart can do. So I'm just using that percentage for you to understand that the heart can function in that level. Okay, like 50%, 40%, 30%. And that should tell you that at that point you are having a lot of trouble. The heart cannot do what it's supposed to do as well. Let me give you another example. Let's take the heart as like the car that transports you from where you are. Let's say from, I don't know much about Kumasi and its environments, but I think let's talk about Ho. So let's just say I'm traveling from Ho to Accra, and I'm supposed to use let's say 3 hours or 4 hours maximum to travel from Ho to Accra. And the heart as the vehicle which is functioning well within a maximum of 3 hours, or let's say 4 hours, I should be in Accra. But when the heart, which is not functioning well, let's use it as a vehicle, okay? And once it starts from somewhere around Sokode, it breaks down. The people have to get down from the bus, then the driver has to repair it. Then you continue the journey from Sokode to, let's say, somewhere around Chito. Then it breaks down again. The driver had to do the same thing, get it fixed. Then the people had to board again and continue. By the time you get to where can I say, Sekuma, exactly. Those of you know there who you can really relate. It has to break down again. You have to spend like some few hours around for the driver to fix it out. And let's say, sorry about that. Let's say by the time you are getting towards Afinia, it's like 5 hours already. By the time you get to from Afinia to Accra, like almost so basically that's what I'm trying to say, that the heart can function, excuse me, the heart can function in, okay. Just a minute, I just want to do something briefly and we can continue from where I ended. Okay, hi, Angela Echin. Yeah, okay. Thank you so much for joining this live, and I really appreciate it. So let's continue, guys. I had a little challenge with my interaction with messages coming in. So let's see how best we can rectify that. So what was I saying? So I was saying exactly. So the rate at which the heart could have functioned, let's using it as a vehicle, you, instead of you to reach Accra in, let's say, 3 hours, you spend like 7 hours on the road. Even though you have finally reached Accra, but you have wasted a lot of time in the journey. And that's what the heart can do. So the heart ideally supposed to function at like 100%, but then it can actually function at 3%, as low as, and that's what we call it as heart failure. So once it starts functioning around 60% and thereabout downwards, we call it as heart failure. So I've explained a lot of stuff in this for you to understand that when we say the heart is failing, it doesn't mean that the heart has actually stopped functioning, but actually what we mean is that, okay, let me see. All right, so someone is asking a question. Okay, all right, that's fine. Okay, let's continue. So someone asks, how then will I know that my heart is actually failing? So I'm going to show you some few things for you to identify if your heart is failing. Now, for the purposes of this discussion, I would like you to see the heart as the shape of a pear, or what we properly know, the shape. When you say draw a heart, you draw the love, but the heart is actually not that love sign. Okay, the heart actually have some chambers, the right chambers, the left chambers. Okay, the right chambers, we have the up and down. The left chamber, we have the up and down. So the right part we call the atrium, and then the bottom part is called the ventricle, separated by the septum. Okay, so when deoxygenated blood, I mean the blood that, okay, let's take it as I said, the heart pumps blood to all parts of the body. Now, when the heart pumps the blood to all parts of the body and they use the oxygen that has been used now leaves that blood, and that blood becomes deoxygenated. And so the deoxygenated blood now will step through back into the heart, and so that is how the cycle continues. So once it gets into the heart, the deoxygenated blood gets into the heart now pumps it back into the lungs. It is in the lungs that oxygen is being added to the deoxygenated blood. So now that blood becomes oxygenated, then it moves straight again into the heart. Then the heart pumps it back to the aorta, to all parts of the body, including the heart itself. So you see how it's very important. Like this, that's what we call the blood circulation. Now, what are some of the warning signs for you to know that your heart is actually failing? Number one is when you find it very difficult to breathe. Now, usually this is one of the earliest warning signs, difficulty breathing. Um, it makes sense because um, um, the heart tries to pump blood to all parts of the body to receive the oxygen, but the more it tries, it's not reaching, giving the body the enough oxygen that it needs. So this is what happened. So eventually there will be a backflow of there's a pressure that we built in the outer part of the heart chambers into the upper part of the body, and then don't forget that I said that oxygen is being produced or given into the blood from the lungs. So there will be a backflow, and once there's a backflow, the pressure built will cause fluid to accumulate and eventually sometimes enter into the lungs. And so you breathe in and out. It goes into the lungs and comes out. Now, when there's a backflow of fluid inside the lung, what do you think will happen? You find it difficult to breathe in, because once you breathe in, it's like there's something interrupting with your expansion of the lungs and stuff. So one of the signs the person will begin to see is finding it difficult to breathe. All right. So, and especially if it's been persistent for a while, your mind should be going through, hey, what's really wrong with my heart? It could also mean something is wrong with your lungs actually, but then you should be mindful of maybe you have something with your heart or heart problem. Do you get the picture? Exactly. So I've mentioned the first thing you want to see to know that your heart is actually failing. The next thing you also want to look at is you easily get tired. Okay, and your muscles uses the oxygen that is being produced or that has been transported by the blood vessels in the blood to all parts of the body. It's using this oxygen to actually work. Okay, so for you to walk, for you to dance, for you to sing, for you to jump, for you to run, it's all the work of the muscles and the joints, the muscles and the skeleton doing this work together, and they rely on oxygen to kind of help with this movement. So if the blood is not, the heart pumping the blood is not able to pump enough of the blood to reach these muscles of the arms, the legs, for you to do this movement, meaning that the muscles will not be able to receive enough oxygen to do its work. Do you get it? So what do you think will then eventually happen? Then at any point in time when you walk small or you do any very little thing that requires you to use your muscles, you then begin to feel very tired and fatigued. Do you see it? So that is one of the signs. When you begin to notice this, you should also be worried, especially when you are a very active person. Then all of a sudden, for some time, you realize that you're finding it difficult to do work, or you easily get tired. Even with the little small stuff, you easily get tired. Then your mind should be like, what could be wrong with me? Could it be from my heart? So, as I've mentioned two, do you remember? If you remember the first, you can drop it in the comment section, and the second one, so you can drop it in the comment section. Don't forget to share this video to your loved ones and friends so you all learn. So we are still looking at heart failure. Now the third sign you begin to see if your heart is actually failing. Don't forget that your heart can be functioning all right, but it's functioning at, let's say, 40%. For all you know, there may not even be any symptoms for you to identify it. Okay, so that is why it's very important. You need to listen to some of this things I'm telling you. Now, okay, so let's see. Have someone drop something in the comment section? Okay, you can drop something in the comment section and I'll be ready to go alongside with that. Okay, so the third thing is that when you are there, you begin to feel that your heart is beating, very fast. It's very normal. Sometimes when you are exercising and you put your hand on your chest, you feel like your heart is beating. That is fine. Because you actually did an exercise and your heart is beating. But people who actually have heart failure, what happens is that even at rest, you can feel their heart beating. That is not normal. That could be a sign that your heart is failing. Your heart is trying to pump, push, do kind of extra work to get the blood to all parts of the body. And in so doing, then it causes the heart to beat that kind of irregularly, and then you begin to feel like your heart is beating even at rest. That should also be a warning sign for you. So if you know, or you have your mom or dad or anyone who around you always complain that, hey, even if I'm sitting, I feel like my heart is beating, that should be a warning sign you should not ignore. Please, you get it? Exactly. So I've mentioned the first one, as I said. Can you remember the first one? I said what? Difficulty breathing. And I went on to talk about easy fatigability, that you easily get tired. Then the third one is when the person feels their heart is beating fast. Okay. Sometimes even without doing any work, you feel like his heart is beating. That could be a warning sign. The fourth one would also be when he lie down flat. Okay, he finds it difficult to breathe. This should also be very interesting. Let me take it in this way. You see, when you lie down flat like this, hmm? Yes, yes, and you always find it difficult to breathe, it's a warning sign. It's what we call autopnea. Okay, that is a warning sign that your heart is failing, or it has something to do with your heart. Okay, and or you'll be sleeping, and in the middle of the night you wake up all of a sudden finding it very difficult to breathe, what we call paroxysmal nocturnal dyspnea. Okay, it's difficulty breathing in the night. That can also be a warning sign that your heart is failing. So once you have noticed I've mentioned about five symptoms of heart failure. Once you begin to notice this, or anyone in your family, your mom, your dad having this, it could be that the person's having heart failure until proven otherwise. And sometimes they begin to cough, and the cough is not just any other cough. The cough can be there for like maybe some few weeks. Yeah, then you will have some fruity kind of, sometimes whitish color from the cough. That could also be that you are having high fever. There's something I want to chip in quickly. It's when you see, how many pillows do you usually sleep on during the night? I use one. Okay, but when someone uses like 3 or 4 pillows to sleep, not just for the luxury of it, but to support the person to sleep, or to support him because you have difficulty breathing, that could be a warning sign that you are having a heart failure. Because ideally, you're not supposed to use like more pillows to sleep. So you could say that the person sometimes has to put the pillow on the head, and I mean under the head, some around the neck, under their feet, just to enable the person to sleep and breathe well. That could be one of the things of heart failure. All right, please, at this point, I believe you are learning a lot. Don't forget to share this video to your loved ones and friends. Miss Angela Chinin, right? Please don't forget to share this video to your loved ones and friends. Okay, I hope you are learning a lot. So I've said this thing. Now, one of the questions you would like to ask me is that, but heart failure is usually seen in older, older, uh, it's usually seen in older people. Okay, yeah, you say it's usually seen in older people, but that is not true. You don't see heart failure also in it. I mean, in my practice, I've realized that I've seen quite a number of young people in their 30s, 25, actually having heart failure. Yes, and many of them were having an underlying disease like hypertension that they are not even aware of. And usually, most of the time, we say hypertension is found in the elderly persons. No, it's not found only in the elderly persons. Young people also are having hypertension nowadays. So hypertension is one of the leading cause of people having heart failure. So now, with that said, I want you to know what I've mentioned is, when you notice any of these signs, please and please and please don't forget to see your health professional as soon as possible. Now, take note that this is for educational purpose. This does not mean that as I'm speaking to you, even though I'm a doctor, but I want you to go to the hospital for proper questioning from the doctor to relate with what you are saying, and also some examinations and some investigations to be done for them to conclude that you have heart failure or not. Do you get it? But I'm just showing you some warning signs. When you begin to see it, you need to, I mean, rush to your health care provider as soon as possible. Do you get it? Excellent. Excellent. So Don't forget to share this video. Share the link. Oh, share the link. There's someone who needs to hear this. Okay, there's someone out there walking about thinking that he's fine, he or she is fine, but actually his heart is actually begging for help. The heart is actually failing. It's getting like 30% over 100, which is very bad. So share this video to your loved ones and friends. Now, there's something I would like to draw your attention on. As I mentioned, hypertension and diabetes are known to be one of the leading causes of people with heart failure. So hypertension and diabetes are one of the causes of heart failure, especially if your hypertension is not well controlled and your diabetes is not well controlled, then eventually can cause problem with the heart. Now, the funny thing is that a lot of people, especially the young ones, the youth, think hypertension and diabetes is in the latter part of their years. And so they don't bother to care about checking their BPs and checking their sugars kind of frequently to even pick it up in the early stages of their life. So that is where the problem lies. Hypertension and diabetes have been known to also occur even in children. Yes, in babies. Yes, hypertension and diabetes can occur there. In young adolescents, they can have hypertension, diabetes. In the youth, they can, and even the older people, both old men and old women, they all can have hypertension. So don't have that label that hypertension and diabetes is for the people of age, even though the people of old usually have it more abundantly or frequently than the youth. Does not rule out the fact that a young person cannot have hypertension and diabetes. Do you get the point? So for you to kind of care, prevent such thing from happening to you, one of the things you need to do is to um, control your sugars, control your hypertension. If you don't know that you're hypertensive, go and check your BP, probably every month. Try as much as possible to check your BP, and then every month check your sugar, especially if you have your closest relative having hypertension and diabetes. I mean your mom or dad having hypertension or diabetes. Genetically you are prone to have so there's a family history of hypertension, diabetes, so you need to get it checked more frequently than anyone else. All right, so another very thing you need to know is smoking and alcohol. Smoking and alcohol has guys has been one of the things. Look, almost in my in I mean, just to say, most of these health conditions, the lifestyle condition related conditions like diabetes, hypertension, heart failure, and all that kind of stuff, most of them have underlying cause as a result of um, smoking and alcohol. It's true. It's true. So some people take alcohol for a very long time. They've been taking alcohol. Maybe some other time I'll show you how to calculate alcohol. Okay, if you probably have taken alcohol for a very long time, you want to see how to calculate it so that you can know whether you are at risk of getting some of these diseases or you have actually become addicted to this. So with that said, let's now move on. So alcohol and smoking has also been known to be one of the leading causes of that. Exactly. So just to add up, hello, can you hear me? Oh, you can leave some comments in the comment section. Okay, yeah, I'll read it loud. I love it to be interactive. So if you have any question or any clarity you want for this, I would like. Then there's one thing I think I did not say about this. Some of the signs of heart failure is when the person legs begin to swell up. Okay, so sometimes when you press the leg, the legs have swollen up, and when you press it, it's kind of deep inside. That could be one of the signs of heart failure. And sometimes kidney problems can also present with that too. So sometimes when people see that, they're like, oh, why KSU? You have become big, you have become fat. Sometimes people with heart failure actually they gain some weight. It's because of the result of the fluid retention that are stored, like water that is kind of stored inside the body, and then the person has become fat. So they'll be like, hey, why KSU? Why KSU? But why KSU? Why KSU? It is as a result of your heart at the expense of your heart failing. Do you see that? So there are some things sometimes we take it for granted. Oh, like, oh, and some people pride themselves with that. Oh, my here. But meanwhile, why you can say yes, but it's actually underlying with heart failure. So with all this I've mentioned, if you have kind of you have seen someone having certain or complain of these symptoms, the person needs to rush to the hospital as soon as possible. All right. So with that said, I hope you have learned something. Now, when we don't control our heart failure can cause a lot of problems. Okay, what we call complications, and this is very serious. It can lead to stroke. Yes. So you could see that a lot of young men, women are now having stroke. Older men and women are having stroke. Many a times, it's as a result of uncontrolled hypertension, which has caused the heart failure, which the heart failure now cause the stroke. So stroke is one of the complications of heart failure. Heart failure can also has a link to the kidneys. Okay, so the what we call cardiorenal syndrome. So the kidneys can also, once the heart, you know, let me not go ahead of myself. When the heart pumps blood, it pumps about 25% of what it has pumped to all part of the body goes to the kidneys. So that means that if the heart is pumping like 100% to all parts of the body, the kidney alone takes about 25%. Then the other parts of the body takes like 75%. That should tell you how important the kidneys are to the heart. Okay, so if the heart is failing or has a problem, it can eventually, one way or the other, affect the kidney because it needs to kind of pump about 25% to the kidney. So if the heart is failing, and let's say instead of it to pump 25%, it's now pumping, let's say 5%, 10%. What do you think will happen to the kidney? The kidney now also begin to fail. So that's what uncontrolled, heart failure can also cause the kidney as well. So I've talked about stroke, I've talked about kidney diseases and kidney failures and stuff as a result of heart failures. Okay. Another very important thing you can talk about is the lungs filled with fluid, what we call the pulmonary edema. So the person's lung ideally it needs to be filled with air, and then the gaseous exchange happens. You breathe in oxygen, you bring it in air, and then carbon dioxide comes out in that exchange. But now the person's lung begins to accumulate a lot of fluid, and it makes the person very difficult to breathe, and that's where the trouble comes. Because ideally the lungs is not supposed to function in that way. And so what do you think the person will be able to do? Finding it difficult to breathe, and sometimes coughing out, what I talk about, the fruity sputum. And then when he lie down flat, you find it difficult to breathe, and the lungs continue. Another very important thing is that you can have what we call cardiogenic shock. It means that if your heart's pumping at very low, you eventually be pumping low, you'll be having low BPs. And once you're having low BPs and your pulse increases high, then we have what we call shock. Shock can happen, and that's even more dangerous. It has shown that most of this shock, that's cardiogenic shock, specifically as a result of heart failure, kills even faster, more than the person having heart failure itself. Do you see that? So there are a lot of complications. Then there can also be electrolytes imbalance. So that means your level of salt become very low, your potassium will also become very low. And when they all become very low, it becomes um, very dangerous because you need a stabilized electrolyte for the body to function. It's like you having let me just use a charger. You want to charge your phone, okay? You need your charger to be plugged into the sockets, okay? And then the charger will be plugged also into your phone. And once you on the socket, power flows from the socket into the charger into your phone. As simple as that. Now, if any of this miss out, the phone will not be charged. So if I turn off the socket, however, my charger is inside the socket and my phone is connected to the charger, there will still not be power flow. Even if I turn the socket on, charger is inside the socket, and the charger is not connected to the phone, power will flow all right, but what do you think will happen? The phone will still not charge. So that's basically what is happening. So you need electrolytes to pass through this. That's the electrolytes. I'm using them as electricity. Electricity need to pass through this socket into the charger, into the phone for it to charge. So once there's a break or there's difficulty in the heart pumping blood or part of the body, these electrolyte levels will reduce, and that can also even cause more trouble. Okay, so that's one of the things I think I'll talk about. Yeah, so I've mentioned quite a few of them. Now, when it comes to salt, okay, salt is one of the very important things we all take. But then, people with heart failure, we advise that they should kind of avoid salt or reduce the level of salt they take, because wherever salt goes, sodium goes in the body, water follows. So if you are dealing with heart failure, then you take a lot of salt. Water follows the sodium through the body, and once water follows it, water will be accumulating in areas that they are not supposed to be in, can cause you to have like the anasaka become swollen. Your whole body can become swollen. So yeah, so that's as a result of fluid retention. Okay, so sometimes people say, the person has become fat and they have cursed the person. That is why he has become. No, that may not be it. Okay, it's as a result of some of these complications that may have arise from heart failure. Okay, so I believe you have learned something today. Don't forget, as I said, share this video to loved ones and friends. And very importantly, leave a comment in the comment section. I know you have learned something about heart failure, so let me see some of the comment sections here. Okay, so far still this one person who has commented here. Okay, she said hi. Okay, all right. So just share an emoji if you really learned something from today's discussion. Okay, so as I said, my name is Dr. OPJ. Don't forget to subscribe to this channel and like this video. Leave a comment in the comment section for one. All right, thank you so much. I hope you enjoy every bit of this video. So God willing, tomorrow, hopefully, when we get some time, we'll go through a bit about the heart failure or something else. So stay tuned and don't forget to share this video. That's very important. Okay, and probably can come and rewatch the videos again. All right, until then, bye. Okay, so let's see where we can end the video.